long have you been working with?
5 years.
G, like a 54.
What is your job in?
I'm the director of the food program.
Okay, great.
So,
How many people do you have now?
we have about 40 or
Wow.
actually we've lost a number because even we lost 8 to COVID per se. But in the first of the year, we lost far more than we have in prior years, 25 more than our average prior years, just because of the result of COVID. People are declining.
Wow.
So we're so grateful for the vaccine, and thank you so much for your help in getting it out.
We'll all keep working and try to get it out as quickly and as equitably as possible. And
Absolutely.
you guys are part of that equity piece.
Thank you for the opportunity.
So I hope you did get a sense of how excited everybody is here to have you visit, because this has been a big deal for us.
You know,
Thank you.
It's not me, it's this team, and you guys are part of this team. And I'm glad to be advocating for it at every level that I can, that's for sure. From president all the way.
No, I know.
All the way. Did you want to start off, Reggie or Brian, or either one of you guys? If you want to lead off, and then I'll follow, and then we'll have Dr. Coe, and then we'll take some questions.
If you guys just approach the mic, that'd be great.
You go right up there, man. Pretend you're a preacher.
I don't think he has to, I don't think Dr.
What do you want me to say?
Just welcome, what it's like, and why you're excited to have this service.
Whatever.
All right, again, I'm Reggie Tyson. Again, I'm very grateful to have the Governor Cooper and the Secretary, Mindy Cohen, here at the PACE program here in Pittsburgh. Again, I'm on the board of directors. I'm the chairman of the board of directors. And one of the things I'm very grateful for with Piedmont Health is that they've always had the connection to the African American community. I know I came on board for when we had a health fair at my home church. And due to the health fair, they was able to spread the word about Piedmont Health, about how they have a caring heart for the patients, a love for the patients. And I explained to people it's not about any finances, but it's about them. And it makes a difference when you have a agency who thinks more of their patients than of money, especially within our communities, especially lower income communities. And I'm very grateful to have the opportunity to partner with them in the distribution of the vaccination. I know I shared with Brian, I had my vaccination shot, and it caught me off guard for when there was a young African-American female who came in to get her shot also. And she was a little nervous, but she said that she felt at ease for when she saw the Rev, when she looked at me, and a couple of other African Americans. And it made a difference knowing that we were there getting the vaccination, so it removed some of the worries. And again, I just thank you for the opportunity to be here and to share with you about PACE and the Piedmont Health Services. All right, thank you.
Thanks, Rich. Yeah,
Brian?
No, please.
Okay. Thank you, Reggie, Mike, Brian, Marion, everybody who's been here today. Really appreciate you being here, and the work that you're doing is phenomenal. Just seeing people's faces and the relief when they're getting this vaccine, and they're getting it from trusted healthcare providers who have been helping them all along the way, and that makes a big difference, particularly when our mission here with these vaccines is to get them out as quickly and as equitably as possible. And with the way this operation is running, both of those goals are being met here, and we're grateful for that. In a few more days, we'll be at 1 million doses that will have gone off the shelf in North Carolina. We are working on a system to have all of the first doses that we get from the federal government out within a week, ramping up now to make sure people are getting their second doses. And we are hoping for more vaccine from the federal government at some point, and are going to continue to work hard to make sure that happens. Dr. Cohen, I'll recognize you. You might have a word or two to say about, I'll say one thing about the PACE program here and working with them. Being able to keep seniors in their homes has been so important. It helps mentally, it helps physically in many cases, and it helps economically. And the good work that is being done through PACE to try to help seniors stay in their homes as long as possible, we're really grateful for that, and grateful for the contacts that they've made to help people get vaccinated quickly. So Dr. Cohen, I'll recognize you.
Well, thank you, Governor, and I want to thank all the folks here who are partnering together to get vaccine out quickly. You know, our federally qualified health centers are such an important partner in delivering health care to our underserved communities, even before we're in a crisis, but they're so much more important even in a crisis. And I want to thank Chatham County Health Department as well as the health center here for partnering together, because we know it's those partnerships that are going to facilitate us getting our populations vaccinated across the state. So it's a tremendous effort. But I do want to remind folks, we have very limited supply. So while folks are working incredibly hard here, we know all across the state and across the nation, vaccine supply is very limited. So we know folks are going to have patience so that they can come to a site like this and get their vaccine, but it's going to take a little bit of time as we ramp up here. But our goal, as the governor said, is to get things out quickly, but also equitably. And I really appreciate that they are partnering deeply with the community, with our faith community. Thank you, Reverend, for doing that, and making sure that we are working hard to have everyone understand the importance of vaccinations and to come in and get their shot. Thank you.
Brian, do you want to say anything?
Just quick. So it's not unusual for anybody when they get their shot to start crying afterwards, okay? But what we see now is the reason that people actually starting to cry afterwards is because they're so grateful, because for the first time they think there's hope that they can actually be back in touch physically in the same room with the people that they love. So this is the beginning, as the Secretary and Governor said, for us to be vaccinating everybody in North Carolina. We're looking forward to everybody getting vaccinated in North Carolina, and we really appreciate the help that you guys have done. Without them, we wouldn't be here. This is great news for us, so thank you all very much.
I just saw Gigi get her vaccination, and she said she wanted to see her great-grandchildren so badly, and was looking forward to getting vaccinating and turning the corner on this pandemic. So we will open it up for questions. Governor? Brian, you guys?
Governor, start with this. What are they doing right here that you wanted to see, and what are the lessons from here that you would like to see other places take away? Why is this a good model for what you want to see?
I think it's important that we penetrate underserved communities to make sure that the vaccine is distributed equitably as well as quickly. Because there is so little vaccine, you've seen a mad scramble for a lot of people to try to find places, and oftentimes people with time, resources, internet access, they are often more successful in getting a place to get a vaccine. And I think it's critically important in underserved communities where people may not have the access to all of those things, that we try to make sure that these vaccines are being distributed equitably. And we wanted to come and see that. A lot of it is established trust that these doctors and nurses and staff members have already established. We heard a bit about vaccine hesitancy with the staff even that worked here. And so they started with making sure that they educated their staff about how safe and effective these are and how an independent board approved it, because there are systemic issues in communities of color that cause skepticism, rightly, and to be able to show that these vaccines are a product of science and research, and that the staff is strong, and then the patients who trust the staff sort of multiplies out there. And they're doing this well here in other parts of the state too. We wanted to come and to accent it.
I heard you speaking earlier about the capacity. You want to see, obviously, build the capacity of the state. I know the goal has been 120,000 vaccinations a week. Best case scenario, what is the capacity? Can we do 1 million a week? Could we do 2 million a week? What is the goal you're reaching for?
We're up to 140 now with the 16% increase, so 140,000 first doses a week in addition to second doses that are being done. But I'll let Dr. Cohen address the capacity.
Yeah, thanks for that. So we saw just last week that our vaccine providers had a huge week. They did more than 300,000 vaccinations, first and second doses, in just 1 week. So we know that we have more capacity than the vaccine we're getting, and we haven't even tried to max that out yet. I think there's even more capacity that we want to build, so we are at the ready. We want to be first in line to tell the federal government if there's more vaccine, we are ready to get it out quickly here in North Carolina. So I think we had a great week. I think we can even go more than that, but vaccine is limited right now. So we're going to make sure that that capacity is in reserve here, so that when the moment that vaccine comes, we can make sure to access it right away.
Can you say, yeah, we're ready. If they make 500,000 available, we can do it.
We've already demonstrated we can do 300,000 in a week. I bet we can do even more, and we will certainly be raising our hands. Unfortunately, like the governor said, we're at about 140,000 a week, and so I don't see that big of a new availability coming to us, but we'll be ready. We'll be ready.
I have more. Ryan, I want to get you.
Thank you. I just wanted to get your reaction to the news from South Carolina earlier this morning about the South African mutation. Do you suspect that's currently here in North Carolina today?
So we want everyone to act as if these variants are here. And that means doubling down on safeguards. It's one of the reasons why we extended the protocols with our executive order yesterday, because we really don't know yet. We know that this variant is more contagious, and we don't know how that's going to affect the number of cases. So it's deeply concerning, but I'll let Dr. Cohen address it too.
Yeah, so while we have not yet identified that variant here, just like with the UK variant, we're operating as if it's here already, because we knew that this virus moves fast. And so we are monitoring for it to see if we identify it here in North Carolina. But we have identified a number of cases of the UK variant, of the B.1.1.7 variant, which we know is more contagious. And so we have to be vigilant as we go forward here. The 3 W's are more important than ever.
And I wanted to get y'all's response to a concern that speed has been prioritized over equity in the last week. We see in North Carolina with first doses, 82% going to white people, 11% going to black people, 2% going to Hispanic people, and in one site this weekend in Charlotte, they can get as much as 1/4 of the doses, even though the county as a whole represents about 1/10 of the state. So I just wanted to get your response to that concern over racial, ethnic, and geographic equity not being maintained here.
The entire country has to do better on this. It's one of the reasons why we are here today. We wanted to make certain that we got all of our first doses off the shelf, and the state had gotten a little behind on that, particularly when we were concerned that we might have our allocation cut, which would be bad for everybody across the board, and we could not tolerate that. So we did emphasize speed, but also at the same time have been working hard on the equity issue. And now that the state is at a point of being able to, I think Dr. Cohen feels pretty confident that we can get first doses off the shelf within the week. We need to really concentrate on the equity piece, and it's one of the reasons why we're here today. Okay.
How do you define equity, and what metrics should we look at to better ensure that, yes, now we know the state is doing this more equitably? What should we be looking at? How do you define equity?
You know what? I've often said that state government should look like the people that it serves and protects, and the way that vaccines are distributed should look like the population of our state. So those are things that we look at, but we also know that people often in underserved communities are even more vulnerable to this virus because many people live in crowded conditions where it's easier to transmit the virus. Many work in frontline jobs where it's easier to contract the virus. You're dealing with systemic health issues that already are there before, where people of color are more greatly affected. So we really have to put an additional emphasis on that to make sure that people get vaccinated and that we're doing it in an equitable way.
And we have time for one more question.
Okay, I'm going to have you expand if you don't mind, please. You started to mention something about schools yesterday, and we're going to have more information coming about that. What information?
So we are working, Jonah, right now, talking with school superintendents, with the school board, with health officials, and we are analyzing the data and the research and talking to school boards. We already know that there are plans in place where people can have children back in schools. And we want children back in schools. We know that that's positive. But we're going to come forward with some proposals here in the coming days. But before I talk about that, I just want to make sure that we are talking to people and that we're aligned on where we need to go.
When you talk about proposals like more than Plan A, B, and C, kind of a Plan A,
So there are a lot of school systems that are only remote, and we've seen what the study shows. So school systems have the option to have their children, elementary children, back in school under Plan A, and middle and high schools under Plan B. So not ready to talk about that yet because we're still having our conversations, but do recognize that study exists. We do recognize that a priority throughout this entire process has been to get children back in school because we know of the many benefits that exist there, but not ready to talk about it publicly.
That's what we have time for. Thanks, y'all.
Okay, guys. Thank you.
Thank you. Appreciate it. Sorry. So,